Emdr for PTSD, eye movement desensitization and reprocessing therapy for use with post-traumatic stress disorder. What is PTSD? Trauma and stressor-related disorder, developed after exposure to an extreme traumatic event. Traumatic event like violent acts, unexpected dangerous events, serious or life-threatening illness or injuries, exposure to war, childhood sexual, physical, or emotional abuse, the unexpected death of a friend or relative. Trauma on the brain. PTSD occurs when the survival brain state becomes stuck. The brain cannot distinguish what is safe from what is unsafe. The brain cannot differentiate between imagining the traumatic event and experiencing it. History of Emdr. First developed by Francine Zafiro in 1987. A holistic therapy that integrates several other models of psychotherapy. Originally designed to treat traumatic memories, but is now used for other aspects of PTSD. Over 100,000 mental health professionals in 52 countries are trained in Emdr. Use bilateral eye movements to stimulate both halves of the brain. These eye movements decrease the vividness of traumatic images. Become possible to reprocess the memories with positive information. Emdr in practice. Phases of treatment. It is applied in 8 phases. Before dealing with traumatic memories, the counselor assists the client to develop calming skills. Treatment usually starts with the earliest related memory. Phases are applied until memories no longer activate distressing thoughts. Treatment can help us a few sessions or a few months. Emdr phases 1, 2, and 3. Simplified version. Phases 1. Full history of event. Phases 2. Client-counselor relationship is established. Phase 3. The client identifies the negative emotions and rates their distress with established a baseline. Emdr Phase 4 with traditional method. Phase 4. The client focuses on the visual image negative belief, and the counselor moves their fingers back and forth in front of the client's eyes. Bilateral brain stimulation can be achieved through a tapping alternate hands or through auditory stimulation. Emdr Phase 4 with the EBC device. It is this phase where the EBC device acts replacing the counselor in applying stimulation. The EBC device is more effective than the movement of fingers to make the patients move their eyes. This is because the patient will stimulate simultaneously with alternative tactile sensations in both hands, and also will be stimulated with auditory stimuli in both ears. The simultaneity of these 3 types of stimuli cause the treatment will become more effective. Emdr phases 5, 6, 7, and 8. Phase 5 begins when the client can access the memory without distress. Phase 6. The client notices tension on their body while thinking of the memory. Phase 7. The counselor determines if memory has been processed and assists using self-calming techniques. Phase 8. The counselor determines if the treatment maintains and assesses for new triggers. Emdr Phase 7 with the EBC device. It is at this point that the EBC device acts EEG feedback sensors to check the effectiveness of the session. First, check if bilateral action stimulus corresponds to the activation of the population of neurons in the area of the corresponding brain. Then the dominant frequency, delta, theta, alpha, or gamma, is measured to determine the alertness-relaxed ratio of the patient. Depending on a polynomial yet to be determined in collaboration with specialists in Emdr that combines these variables can conclude the extent of use of each. Evaluating Emdr, judged to be more efficient than alternate treatments. API reviewers grade Emdr as effective for civilian PTSD, post-traumatic stress disorder. Can be produced a decrease in PTSD diagnosis of 60–90% in 3 to 8 sessions. Repeatedly shown to be equally effective to CBT and prolonged exposure. Has shown to be less effective for combat PTSD and multiple incident PTSD and multiple incident PTSD.